If someone has fine lines or wrinkles that are static in nature, that is, the wrinkles that are there when someone is not moving the face, these wrinkles are developed due to a combination of repetitive dynamic movements, loss of collagen, fat depletion, and skin laxity over time. And in order to address them effectively, one would need a multimodal approach. We know that botulinum toxin is for the treatment of dynamic lines. It relaxes the muscle responsible for these lines in certain areas, especially the upper third of the face. And the toxin is used to prevent further deepening by regular injections. However, there are patients with fine lines or wrinkles that are not dynamic in nature. We call them the static lines. In order to treat them effectively, we need to consider restoration of collagen with skin boosters, which hydrates and stimulate collagen production, improving skin quality and eventually reducing these lines. Monopedial threads also stimulate collagen remodeling, providing skin thickness over time, improving static wrinkles, and improving skin elasticity. Microneedling with biostimulators, MRF or microneedle radiofrequency or laser resurfacing, can stimulate deep collagen regeneration and resurfaces the fine lines. So in summary, consider regular botulinum toxin treatments to prevent deeper static wrinkles, having skin booster and pedial threads to improve skin structure and resilience, and collagen stimulation treatments such as microneedle RF or even lasers to maintain the youthful skin.
Please like, subscribe, and comment.